this is the skin.
Yeah.
Okay, this is the lid margin, all right? And here, you see, the lid margin is 1 millimeter up, and the skin is on top of that. So you have an excess skin, okay? But you also, your lid margin is also a little bit lower.
Yeah.
And you know what you do? In order to, especially you have the same problem for probably in this eye, but you elevate your eyebrow like this.
Yeah.
So this one is more open. So actually you have both, but we need to do some tests for that.
Okay.
Probably one day before. If I don't pull your cheeks so much, you know, after surgery you're gonna look like that. This is gonna be like chiseled like this. This is gonna be like that. Unfortunately, this part goes a little bit down, but this part will stay like that. So that's what a deep planes face and neck lift. So I'm gonna have can you put your up? I'm gonna have an incision here as well, like here. So it's gonna be very well hidden, but it's a scar. It heals very well. I've never seen complaints about that. So can you do like this? So this is a platysma, okay? This is continuous with your cement layer, all right? So we're gonna cut this from here, from this incision, and we're gonna suture them here, like that. And we're gonna pull the rest of it. We're gonna become 54, right?
Yeah.
And in that 3 years, you're not gonna age like 3 years.
Oh, okay.
Okay? Do you know what I mean?
Yeah.
So you're gonna age also slowly on your face. That we operate. Results of that facelift, actually, you're gonna see properly, like not operated look is gonna be 6 months. Okay? But I would say 3 weeks, you're gonna be dinner ready. All your neck. It's for the skin draping.
Okay.
It looks hideous, but I'm gonna take them off in 48 hours.
Yeah.
You will probably want, I'm not gonna let you see it, so don't worry, but if you want, I can show you. Some patients might be scared of it, but that's the best way to control bleeding, swelling, and also it's very good for skin. 2 days later, even if you stay for 1 day, 2 days later, I'm gonna meet you to take these stitches off, or our nurse will take the stitch off, okay?
Is she going to use garment?
After taking the stitches off, we won't use any garment.
Oh, not
it's
even
not
doing
necessary. No.
Okay.
You're gonna be very free. Okay.
Okay.
And you're probably you're gonna feel a tightness. But if you develop hematoma or some problems, you're gonna feel pain. And after 1 week, you wouldn't have any.
And what about how can you eat?
You can eat.
Okay.
Everything, no problem. Connoisseurs,
Yeah.
we call, might go a little bit up, but you know what? It's a challenge in plastic surgery. We can't make people smile, you know. So, and even if you wanted to, I wouldn't still give it to you. You know? So that's very hard to do. And another thing, after surgery, you might have transient facial nerve palsy, but it's always transient.
Yeah.
You wouldn't see permanent thing. And usually after 2 days here in the lower lip, sometimes we'll check on you, of course. And if something is really not going off, then it's usually some small clots or stuff like that. Usually be on top of the nerves, and then I don't know if you just open. Sometimes it's like the plants. When you touch them, they kind of So it's basically the same principle.
Yeah.
But they come back. So don't worry about it. You're gonna do your research and you're gonna see about this. So I'm explaining you beforehand, and but it's always transient. Okay, so don't be scared about it. That's the best age, I would say. And after 60, it gets hard to have a really good result. And I think 50 is very good. 50, you'll have a really good result, but you can't make 50 look 30, you know?
No.
That's what I'm trying to say. I can make 45 look very young, but 50, so when the age goes up, you can't have a dramatic effect. So that's a problem, because if I try to be more dramatic, I would be more aggressive on the surgery, and then that will cause more problems, more swelling, and so I don't want to do that. This is a luxury thing, you know. I want you to be happy. I don't want to look like that you're hit by a car, you know. So let's be more gentle. So for that, I think 50 is very good. After 55, 60, it gets a little bit harder to have a desired effect, you know.
Skin will be thinner also.
Skin will be thinner. It will be less elastic, you know. But if you get older, the scars look better. That's a good thing. But in the end, the scars look very good. So don't worry about it. I mean,
It's
if you don't
really
have,
hard to tell.
it's really hard to tell because we don't do it like in front of here. We're gonna do it just in the right behind the ear.
Yeah.
People will understand.
And you remove skin.
I will remove
Oh,
skin.
yeah.
Yeah, sure.
Oh.
I will remove the excess skin, and because I'm gonna pull the tissues, the muscles up, and that they carry the load of your face, not your incision. So if in plastic surgery, if the incision has a tension, then it will be hideous scar. But with this technique, actually, the muscles carry your load. So I just put the incision with no tension, and I do all the stitches by myself. So I'm gonna do it with very tiny stitches with like maybe thin like your hair, you know. So it takes more time than the surgery actually.
Yeah.
And we're gonna stitch it very well, and then we're gonna remove that after 6 or 7 days. And then when we remove it, you're gonna see, even if with the scarring, you won't even notice very well because it's gonna be well hidden in your creases.
Yeah.
So it's more artistic.